Thank you for attending Positive Behavior and Supports for the Special Needs Child, presented by Maxim Healthcare. My name is Jill Flynn. I'm a behavior specialist and a former special education teacher, and I'm going to be presenting the information for you today. Relationships matter. Relationships, building relationships, it's the foundation of everything that we do. No matter what job you have, building relationships is key. As a professional nurse, taking care of your patients can be very rewarding and fulfilling, but it can also be emotionally and physically draining. Your job is very hard. You are not only working as a nurse, but part of what you do is working as a customer service professional. You're trying to make everyone happy in the situations that you are in. One way that you can really build that relationship with your patients and with the families that you support is by maintaining a professional, courteous, interpersonal relationship at all times, and that can really be challenging. But we know that a strong nurse-patient relationship, it's essential for positive behavior support. We're going to talk a little bit about ways that you can build relationships, and we have them listed here. We're going to go into more detail, but in general, these are some things you can do to really expand and build a relationship with those that you care for. Be present. Have your eyes and ears open to everything. Keep your patients and families updated. Even if your patients can't respond back, make sure that you tell them what's going on. Spend some good quality time with your patients. Learn about them, have patience, and make it personal. As a nursing professional, you have a very busy job, but no matter how busy you are, one way to really solidify the relationship you have with your patients and families is to be present. So when you're with a patient and there's lots of other things going on, make sure that you can maintain your focus on the person that you are caring for. This means keeping your eyes and ears focused on your patient, the most important person. Even a patient that is nonverbal needs to know that you are present. Make sure they can see that you are looking at them and providing eye contact, or maybe you are caring for them and they know that by the way that you are touching them. This is very important for all patients and all children, but particularly for those that are nonverbal or very significantly impaired. Keep your patients updated. Let them know what to expect. Let them know what's going to be happening. And this is true even for patients that cannot talk back to you or answer. If you have patients that are verbal, they might have questions and want to ask you things that are going on and why they might need certain interventions or procedures. Do your best to answer their questions in a way that they understand. Nurses are busy. You have one of the busiest jobs, but something we know to be true about building relationships is that we have to spend time with the people that we're trying to form relationships with. This is very difficult for you because you have lots of other responsibilities, but it's essential that you try to do this. Make the most of your time that you have with a patient. Engage with them with things that they are interested in. Talk with your patients even if they can't talk back. Just hearing your voice can really help to make that connection. Learn about your patients, not just about them, but learn about what they are interested in. What are their favorite hobbies? What are their favorite places, their favorite foods, books, TV shows? Are there any upcoming events that the family might be looking forward to? These are all great ways to connect and great ways to form relationships. Nurses are known for a few things. You are known for that skill that you have that you bring into the homes of the patients that you service. You are known for your calm demeanor. You are also known for having patience. Nurses' patience is legendary, but, and you know this, it's not always easy. When patients are scared or they're in pain or they are experiencing a particularly difficult emotion, it can be very challenging as a nursing professional to have patience. What do you do when you come across difficult situations? What if someone's temper flares while you are supporting them? Do you ask questions? Do you ignore the situation and continue on calmly? Do you address it directly? If you don't have a good system in place for this, check with your supervisor. What does your supervisor recommend that you do when you encounter a situation that's not easy? Always remember that to build those lasting relationships, it's very important that the nurse is tuned in to what the patient needs, not just physically, but also emotionally. Here's a quote from author Brené Brown. She states, "To learn hopefulness, children need relationships that are characterized by boundaries, consistency, and support." Now that we've talked a little bit about relationships and how relationships are really the foundation of all that we do, we're going to dig a little bit deeper into understanding behavior and understanding positive behavior supports. Children misbehave for many different reasons, and as a caregiver, it's very important that you are able to understand and figure out why the child that you're supporting is misbehaving. And there are many reasons. The child could be curious. They could be ill. They could be bored or have angry feelings. They might just need your attention. They might be suffering from low self-esteem, anxiety, or even confusion. Understanding what is behind the behavior is key into putting a stop to that behavior. Positive behavior supports are also a process to understand and resolve problem behavior of individuals or of children, and it's based on research. It is really based on understanding why the child engages in the problem behavior and implementing strategies to prevent the occurrence of that problem behavior. We're going to talk a little bit about self-regulation. Self-regulation is also known as self-control or emotional regulation or emotional control. This is really the ability to tolerate frustration, disappointment, anger, and sadness. And children really learn these skills at different times. They need to experience different things. They need to have the ability to practice regulating emotions in different situations. And as you can probably understand, that often takes time. When we are talking about a child that has a disability, they could have increased difficulties with self-regulation or this emotional control. When a child has developed self-control, we know this because they know what to do, they know when to do it, and then they can behave appropriately even when their parent or a grown-up or their caregiver isn't there. So self-control really helps children feel safe, it helps them feel confident, and it helps them feel in control. So again, when we are talking about positive behavior supports, we're really talking about ways that we can help children learn how to behave in the appropriate way. We want to be able to teach children to control their actions and make good, healthy decisions. Positive behavior supports combine support, encouragement, and setting limits, and we're going to talk a little bit more about that in a moment. It also encourages appropriate behavior and helps stop that challenging behavior. It also helps children build self-confidence. And really, all children need to learn self-regulation or self-control so that they are safe and healthy. Learning self-regulation helps children like themselves better, and it helps them get along well with others. When we add this strategy with love and with respect, we can see great changes in children's behavior. Before we talk about what you can do to help the patients that you support build that self-regulation, we are going to tell you what not to do. Based on research, we know that yelling at children does not work. In fact, it has the opposite effect of what we would like. We want to build them up, but yelling at children actually tears them down. They start to feel bad about themselves, and they actually develop fewer feelings of self-control. Also, constant questioning of children really helps them feel more discouraged, and a discouraged child is more likely to misbehave. Other things we don't want to do, we don't want to bribe children. We're going to talk about reinforcement, which is different, but bribing is giving kids something so that they will stop that misbehavior, like candy or toys in the store. We don't want to bribe children because they won't learn self-control if we do that. We don't want to make children promise to behave. Sometimes they're going to tell us, oh yes, I'll behave, but they really don't have the skills to do that. Again, we don't want to shout or yell. It can frighten people, and it really doesn't have a positive effect on behavior. And we don't want to shame or belittle because that will definitely impact children's self-esteem. Now we are going to talk about what you can do. What we really want to point out is that it's very important as parents or caregivers that we understand what appropriate expectations would be for the people that we serve. So what is reasonable to expect of young children, especially young children with special needs at each stage of development? We want to know how to respond to children and how to help them understand their feelings. Some behaviors are actually signs of typical development, and we want to be aware of those as well. Something that's really important that we need to make sure that we have in place are limits. You need to be able to set limits with those that you care for. That means having clear expectations. So be very clear about what it is you expect that child to do as far as behavior is concerned. And also being consistent. If you ask them to do one thing one day and something else on another day, you are going to see more troubling behavior because you're not going to be believed because you haven't been consistent. We also want to make sure that these limits we are putting in place are age and developmentally appropriate. Some tools that we can use to guide behavior are as follows. We can divert attention. If your child, your patient, is having challenging behavior, sometimes we can divert their attention away from the problem that they're having to something else. So if they are having a tantrum about getting a certain food that they want, but it's not time to eat that yet, maybe we can distract them or divert their attention to a book, and we can read that book with them, or to a TV show, or to a song. We talked about setting limits, and again, that just means we have to be consistent every day in our expectations of that child. Another great strategy is offering choices. If your patient is having a hard time following a direction that you might have given, we might want to offer choices. Offer two things that they might be able to do. So if you have asked your patient to come and sit at the table for their medicine and they refuse to do it, you might say, would you like to sit in the beanbag chair to take your medicine, or would you like to come to the counter? When we give children choices, it makes them feel like they are in control. And if they feel like they're in control, often we're going to see better behavior. We can redirect them. So if we've asked them to do something and they haven't done it and they might not be listening or doing something else, we can redirect them. We can do that verbally by stating our expectation again, or we can do it non-verbally. Maybe we have a signal that we've made with that child that we can use to direct them to the behavior that we would like to see. And also we can reinforce behavior. So when we see a child exhibiting that good behavior, that socially appropriate behavior, we can reinforce that. We want to catch them being good. We're going to talk a little bit more about diversion. Often children with disabilities may have shorter attention spans, and this can sometimes work in our favor. So knowing all about them and knowing their interests, when that behavior is starting to get difficult, we may be able to use their interests and shift them from what is happening with that behavior to a different activity. We want to make sure that we're working with the children that we support and not against them. Young children, even children with special needs, are very good at engaging us in power struggles. And we don't want to become involved in a power struggle with a child. So it takes two people to have a power struggle, and if we don't engage in that, it can't happen. But we do want to work with them. Again, going back to finding out why they're misbehaving, why they are having challenges, and this is going to help us figure out a solution. Some additional information about setting limits. It's okay to have rules in order to manage a child's behavior. We don't want too many rules. I would say at the most maybe 3 rules would be appropriate. And we want to make sure that the rules that we put in place are very clear. We don't want to have a rule like be good. That's very broad, and be good could mean different things to different people. We want to make sure that the rule that we have is very concrete and very clear. So it might be the rule is sitting at the table when you eat, or keeping your hands in your lap while I'm giving you your medicine. We'll expand a little bit on the strategy of offering choices. Again, offering choices makes the child feel that they have some control in situations that typically they don't have any control. So when we offer more than one choice, we offer 2 choices. We need to make sure that they're acceptable choices and that we can follow through with both. But again, this might really help them get out of that negative behavior. They make one of the choices and then they are able to behave more appropriately. We're going to move on now to talk about how we can reward good behavior when we see it. There are many types of rewards that we can give to children. There are social rewards. This really is praise, giving them compliments, giving them positive words, positive gestures like a thumbs up or a high five or a hug. Some children, this is the only reward they need. They get a lot of gratification just from hearing the adults in their life letting them know when they're doing well. Then we also have material rewards. These could be small toys or special treats that the child likes. Examples would be stickers, special notes, coloring pages that are of interest to that child. And then we also have activity rewards. This could be an activity that the child likes, having a favorite adult read them a book, playing a game with someone in their house, or going outside or to the park. I do want you to remember that the behaviors that are rewarded the most often are the ones that you are going to see the most often. We are going to go over some reminders about positive supports. Some do's and don'ts. We want to make sure that we are using positive language. So we're going to tell the children that we serve what they can do instead of what they can't do. Instead of saying, don't drop that egg, we might say, remember, carry the eggs in both hands like this. We might say, instead of, don't drag your jacket in the mud, we might say, tie your jacket around your waist like this, or let me carry it for you. So we want to make sure that our language is supporting the positive behaviors that we would like to see. Also, bad or challenging behavior could increase in the short term as the child that you're supporting tries to see if they can get around what you've put in place for them. But again, we need you to be consistent. And if you are consistent over time, you will see a behavior change. If we're not consistent, then children are going to lose their trust in us. They're not going to have confidence in us because they know that the rules are changing frequently. This can be a really big challenge when there's more than one nurse on a case. It might be important to have a conversation with the nursing team so that you all have the same rules and that you all are giving the same consistent message to your patient. Thank you for attending this training on positive behavior and supports. You can go to the link in the comments and take a short quiz. Once you've completed that, a certificate will be emailed to you. Thank you so much from Maxim Healthcare.